Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Over the last several weeks, we've been talking about infertility, different causes, mechanisms. But how do we test a patient when they come in terms of what we need to look for patients who have infertility, both on the female and the male side? So routine blood work can give us some clues as to what might be going on. So routine blood work can be run through your insurance. Most medical insurances will cover these routine blood work. So let's get into some of the specifics, okay? So when we look at it, routine blood work is necessary. And within that routine blood work, you're going to look for a comprehensive metabolic panel, right? That's looking at things like liver enzymes, cholesterol, and those types of things. You want to do a complete blood count, looking at your red blood cells, white blood cells, and then breaking them down in terms of what the red blood cell is composed of and what the white blood cell is composed of. So when you look at red blood cells, you want to look at hemoglobin, hematocrit, MCV, MCHC, etc. You also want to look at things like ferritin and serum iron to make sure we do not have a patient who has anemia. So a complete blood count would be helpful. Vitamin D is also very helpful because vitamin D is important for immune regulation, overall health and vitality of a patient, right? So we look at the 25-hydroxy form of vitamin D. A comprehensive thyroid panel is very important also. Now, I have a whole section on thyroid, but a comprehensive thyroid panel should include TSH, total T4, total T3, free T3, free T4, thyroid antibodies, reverse T3. So there's a bunch of them you can run to make sure we do not have an underlying thyroid issue that might be a cause of infertility. Also, we'll look at a couple of different hormones like prolactin and then what we call luteal phase progesterone. So when we look at the female hormone cycle, we want to look at it in certain phases. So we want to make sure we have proper progesterone levels during certain phases. Another one is fasting glucose, insulin resistance, diabetes, or hypoglycemia can create issues with fertility. So you want to look at first morning glucose after fasting 10 to 12 hours. Then you also want to look at hemoglobin A1C, which is basically a 2 to 3 month average of average blood sugar. So it gives you a better picture as to what your sugar has been doing for the last 2 or 3 months. I characterize this as like a snapshot, like a picture in time. And then this is more like a video, right? So this will give you a good idea of what was actually happening before and after this picture, okay? Another one is autoimmune markers. Autoimmune markers can be thyroid antibodies. Another one is ANA, or you can look for sperm antibodies, right? So you can look at different autoimmune markers because that may be the underlying mechanism of infertility. So this can be just a general panel that you can run for a patient who has the complaint of infertility, or someone who's just trying to get pregnant and they're not even sure, right? They might be in the initial phases of getting pregnant. So it's very important to do a comprehensive exam when a patient comes in with infertility, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And next week, we're going to talk about the functional medicine markers for infertility. Okay? Have a great day.